Hi, everyone, and thank you so much for tuning into this episode of Mom Mode. Today, we have Dr. Samantha on, who is an amazing person, doctor, helping many couples that are going through infertility reach their goal in getting pregnant. So, Dr. Samantha, thank you so much for being on the podcast. And I'm just going to kind of hand the baton over and have you just share a little bit about who you are.
Hi, thank you so much for having me. Super excited to be here. So yes, I am Dr. Samantha. I specialize in fertility. I also work with hormone health and gut health very often. I just have a passion for natural medicine. I didn't say that earlier, but I'm a naturopathic doctor. I have just such a love for treating the root cause and helping people on their journey to optimize their health and their fertility. And I can't wait to chat today.
Yeah, I'm really excited because this is kind of like, not that I've never been natural, but I've really, as I'm getting older and just things start showing up in your health and you go to a doctor and they're like, oh, well, here's this medication. I'm just like, no, this is not the route that I've ever had to go down. I've never been on medication. And if I listened, I would be on like four different medications right now. So I'm just a huge believer in the root cause. I try to share it with so many people. And so it's really amazing that that's kind of the route that you took, which leads me to like asking the question of, did you always know that you wanted to kind of go that holistic natural route with your career? And is that what you originally had gone to school for?
Yeah, so very long story short, I actually, when I was younger, needed a lot of healing to happen. I went through a really long healing journey without oversharing too much. If anyone wants to know about it, I actually have like a whole YouTube, like 30-minute video on it. But I went through a lot, and my mom actually found natural medicine. And so from when I was little, we always used holistic methods. We always were going to naturopaths and chiropractors and acupuncturists. And so that's just kind of ended up being my upbringing and how I saw and thought of medicine. And then, I wanted to be one. And then I was like, I don't want to go to 4 years of med school. That sounds terrible. And I kept trying to find a way around that. But long story short, every path or every door I went down or every yeah, like I said, path that I took just ended up pushing me towards natural medicine. So after my undergrad, I decided to go to a naturopathic medical school. Yes, it was another 4 years. And we still take boards and we still have to, pass a first round and a second round. And, it was really hard. I would say it was definitely worth it. And I definitely found my passion. I mean, I love helping people, like I said, get down to that root cause and specifically fertility. It's just such a niche and it's something that's needed right now. And I definitely found my calling, but it took a little bit to get there.
Yeah. Um, it sounds like it, but that's awesome. So, and yeah, I feel like so many times when you talk to somebody and you're like, oh, I'm going to see a functional medicine or a natural doctor or holistic, all these words that we have, you're like, or a lot of times you'll get the response like, well, they don't really know, like you have to have like the medication. And you just find that like they almost don't trust the education behind that doctor. And so I guess for you, like maybe we could talk about that. Functional medicine, holistic doctor, natural path, like they all similar or are there differences? Because you have an educational background, but do all of those different titles do?
That's a really great question. And to be honest, that can get really complicated fast, especially when you're talking about like the
Mm.
world of Instagram and like self-proclaimed experts in that world. But there are, a few, I would say, major categories. So there are functional practitioners. Those are usually like MDs, DOs, or NPs, or even like nurses or nutritionists that have gone on to get extra training in functional or holistic medicine. Some programs are a couple months, some programs are a year long. So everyone's going to differ a little bit with their holistic training if they have like an MD, a DO, or an NP, etc. behind their name. They're still great, and I'm so happy that that's like a thing now because it never was before, and it's showing that they're trying to also learn to try and treat the root cause, because in conventional schooling they actually don't learn that. Like that's like a
Mm-hmm.
part of our schooling. We literally talk about it all the time. It's like on the walls. And so for us, for 4 years, it's like hammered into us, but it's a completely different experience if you're in a conventional educational path, right? So that's
Mm-hmm.
where those functional practitioners are. And then there's like certified nutritionists and certified health coaches and other practitioners that don't necessarily have like the schooling that we'd normally picture with like more like health experts. It's still not to say like they're still great at like what they do, but sometimes I do feel like they might reach outside their expertise a little bit. Like they shouldn't be ordering labs and treating and diagnosing. In my opinion, they should be more helping, people achieve their goals based off what like a functional practitioner or like a naturopathic doctor says to continue on with. And then there's
Mm-hmm.
me, right? Who's a naturopathic doctor. And there's a naturopathic doctor, and then there's a naturopath. So a naturopath, that is something that exists, and that only needs like, they only need like 3 months of like a certification, maybe six. Ours, a naturopathic doctor, you actually have to go to undergrad. You have to 4 years of undergrad completed. Then you have to have 4 years of medical completed. Like I said, you have to pass 2 rounds of boards. You have a state licensure. Every state varies, like what you can do in each state. I am located primarily in Arizona, and because I am here, for people I treat in state, my patients here, I can order medication, so I can prescribe, I can order labs covered by insurance. I can even work with insurance if I wanted to. I just choose not to because I feel and like insurance is messy and it can dictate too much. But
Mm-hmm.
we learn basically everything MDs learn with an add on of homeopathy, nutrition, psychology, botanical medicine, hydrotherapy, physical medicine. And so we still learn the pharmacology. We're still learning all the basic sciences. We just kind of have that in addition to. And again, we learn to treat with a mindset of treating the root cause. So, like, yes, their thyroid is not functioning optimal, but why? We don't just learn to prescribe the medication. We learn about foods that are good for the thyroid. We learn about homeopathy. We learn about herbs. We learn about how the gut health can relate to the thyroid. So it's obviously I'm biased. I'm obsessed with my medicine. But that starts from the beginning though. That's first year. Even though we're learning the basic sciences, we're still learning the foundations to what creates health. And we
Mm-hmm.
actually live off of something called the therapeutic order, which I can really get into, but essentially just means treat with the least invasive and then end with the most invasive as needed.
Okay. Now you mentioned thyroid. Um, it's interesting because I feel like I'm reading so much, I'm seeing so much about thyroid. I have my own, that's what made me kind of go the holistic route. And I'm seeing a functional medicine doctor was because of my thyroid during my pregnancy, and I don't know if I had anything before being pregnant or if my pregnancy triggered this reaction that my thyroid's having. Um, so why are we seeing this so much? Like I feel like so many women and like maybe they don't even know there's something going on. I had preeclampsia with my pregnancy.
Mm-hmm.
And so early on my thyroid, like I needed to be on a thyroid medication. They were like, "Hey, your thyroid levels are not where we want them for pregnancy. You can miscarry. We're going to put you on a thyroid medicine." So I got on it. I was like, "Okay, I guess I have to do that." But obviously, after being pregnant, I was like, okay, what caused this? Did my thyroid cause the preeclampsia? I don't want to be on thyroid medication, which I was able to get off of it after. But are you seeing a lot around thyroid as well?
Yeah, I mean, especially because I am in the fertility and just hormone health space, and particularly thyroid is definitely something that we're measuring all of the time. We're being very mindful of it, and not just like a TSH and a free T4, right? We're looking at
Mm-hmm.
TSH, free T4, free T3, reverse T3, thyroid antibodies, and so on, honestly. I have the basics I like to draw because they can also get really expensive to draw some of these. So I try to be mindful about that, but um, definitely at least getting like the TSH, free T3, free T4, and thyroid antibodies are going to be really important. And I think we've noticed a major shift. One, people are actually being mindful about talking about it. Like this is something that naturopaths actually preached, or naturopathic doctors have been preaching for, I don't even, since I was young, right? Like this is something
Mm-hmm.
that we've been saying we need to look um at for women. And I just think it's being checked more because it's finally being recognized that like that is a root cause of a lot of issues. But what I will say, and just because it's been something that I've seen, something that's been bothering me lately, is everyone gets like a thyroid level done, and immediately they're put on a medication. Just because your thyroid's a little off one time doesn't mean it's going to be off every time. So I usually like to check it like at least 2 times before we're jumping to medications or things like that. I personally believe that we can also work and heal the thyroid via gut health, and I've seen it many times. I myself have been on thyroid medication for an extended period of time, and I've now been off for almost 10 years now. Um, and I would recommend finding someone to do that with. I wouldn't just go cold turkey, but I think that they found something that seems to be present in a lot of people, like elevated TSH or thyroid antibodies. And now we're just jumping so quickly to medication when, like, maybe they were just sick for a little bit, or maybe we were extra stressed. And that can cause the thyroid to function less optimally. Like you were saying, even with pregnancy, right? Like when you're pregnant, your body needs a little bit more thyroid hormone. You also need to give it to baby before they develop their thyroid, right? So
Mm-hmm.
you're going to be stressing the thyroid more. And so they probably should have given you actually thyroid in that situation. That's the one time where I'd be like, yeah, like we want to avoid loss, right? But other than
Yep.
that, like it should be double checked.
Yeah, no, and I think it's so important. And yeah, I'm just finding, and like you mentioned, gut as well. There's so much information that I feel like is not given. And gosh, I mean, I'm kind of going on different tangents here, but like the thyroid, the gut. And then when we're getting these, labs drawn for like annual checkups, like you said, there's not extensive labs being drawn that are really showing the full picture. And then also, one thing I'm noticing is the normal range, and then functional medicine has more of an optimal range, um, which is where like our bodies function. Correct me if I'm wrong, like at its best. So, like thyroid levels, there's a normal range, but then there's an optimal range of when, hey, typically a patient feels their best when you're around this number or this little bit of range.
Yeah, you're absolutely correct. And some people ask me, like, where do you get these numbers? Like, they act like I just like pulling them out of thin air. And I'm like, they were actually
Yeah.
just past normal. Like, they're
Yeah.
not out of thin air. They're like historically what's been optimal. Sometimes it's what functional practitioners have seen clinically to be the best for people over like years and years. And I definitely listen to people that have practiced for 20 plus years and take into account like what they've seen. And so that does matter. But like, for example, like, you know, thyroid optimal values are going to change too. Like someone can feel really good at a TSH of 3, but for fertility, we want it under 2.5 because, again, as we were talking about, like when you're pregnant, your body requires a little bit more from the thyroid gland. And so we want it to be functioning at its complete optimal to make sure that we're not stressing it out, to try to avoid going on medication if we can, right?
Definitely.
I mean, you can't help it, like what's going on in your system. You can only try to prepare the best way you can. But um, yes, the optimal versus normal values is definitely a thing. And some people find it silly, but it matters. And right now, they just have optimal values based off the average person. And I'm like, is the average person really healthy? Is the average person at their optimal? I would
Yeah.
say probably no.
No, it's so true. And so I've been just going, I'm like, I'm for everyone going and seeing, like, I'm like, hey, do both. Go to your regular, doctor, go to your OB, but also have like a functional medicine or a natural doctor working with you as well, especially when it comes to pregnancy. Like, I did not realize, how intricate, it's not just getting pregnant, it's a whole new world of information and how our bodies change and what our bodies are feeling. I mean, and it, what our bodies, the different hormone levels, like, everyone talks about like postpartum depression, autoimmune conditions. There's like so many things that are thrown out there that you're like, if you go see a natural doctor, go get certain labs drawn, really work on that, gut health. I just feel like people's lives can be like transformed. I'm like a true believer. Um, what led you into the fertility space? So like upon graduating, did you know that you wanted to work with? Because that's, I mean, I know you obviously treat all patients, right? Men and women, but I feel like
Yeah.
that's kind of like your specialty.
Yeah, fertility is definitely my specialty, and I actually work with a lot of couples. Like that's I have like packages, and that's my primary package is like the fertility for two, because it does take two, right? And
Hmm.
men can have hormone and gut issues just like women can. Obviously, for females, it's a little bit more intricate. We have a little bit
Yes.
more going on, but they still need like nowadays. It's very rare when I see a male that has optimal testosterone. Like that's very rare. Um, and I know I'm in the fertility space, but also same thing with like sperm health. Like it is wild the tests that I see now and just like how much our world I think is impacting male sperm, concentration, morphology and motility. So essentially like the shape and like how it swims. Um and it's just been kind of wild. But how I got there, sorry, I wasn't answering your question.
No, you're totally good.
um I actually wanted to do pediatrics. So because I was really sick as a kid, I was like, I want to help all those little kids out there, right?
Hmm.
So I really was interested in that, and I did a lot of. You can kind of pick your extra courses, and all my extra courses were essentially in pediatrics, but also women's health. So I did a lot of that, and all my extra shifts were also both women's health and pediatrics. I We actually have a pediatric track, like an added like bonus track essentially at our school. And I was on the track to complete that. But then honestly, like in my last year, COVID hit and we couldn't be in clinic that much. Or if we were, it was like hands off. And long story short, I was like, I'm not getting enough time with pediatrics. Like with peds, you have to spend a lot of time in clinic to really understand kids and to be able to learn how to do physical exam on them because they are moving around, they're crying, they're upset. Like you really have to spend a lot of time to get good at that. And I just
Hmm.
wasn't there. And I knew I wanted to get out of school and start my own business, maybe do like a mentorship, but I didn't want to really work with anyone or under anyone. So I decided to switch gears, found a fertility course, and I fell in love with it, and then found out she did a mentorship. So I did the fertility well, not 3 month course. It's like a package of courses, and then I did the year-long mentorship with her, and I was like, this is it, and I just got I feel like good at it, right? Like some people you're just good at something like cardiology,
Yeah.
not my jam, reproductive health, just it clicks for me. And so
Hmm.
I just kind of fell in love with it, but it's kind of cool because my family has a history. Like my mother had a loss, my grandma has actually adopted two children because she wasn't able to conceive for 10 years. So like it was kind of wild how it kind of fell into this. But it
Yeah.
was like, wow, this has impacted my family in the past. So maybe that's why.
Yeah, definitely. And I'm sure it's just such a beautiful journey. I mean, I'm sure there's difficult times, difficult conversations. Obviously, when someone is at a point where they're contacting you, they haven't had success. So I'm sure it's
Mhm.
not easy. They're just like probably looking at you for answers immediately. And it takes time. Some probably
Yeah.
faster than others. Um, but I'm sure like treating them and then them having success is like I don't know. I would get super emotional.
Oh yeah,
I've
I
see
definitely
like the
cry.
testimonies that you have. Yeah. I mean, I would cry too. It's beautiful. And especially when someone's coming to you and they've been struggling. Um, what now you kind of brought up like men's sperm. And I've been like reading about this as well, and hearing about this, especially with like miscarriages, women having miscarriages or chemical pregnancies. And so you mentioned something about you're seeing like a shift in sperm. What do you think is like contributing, the most to this, from what you're seeing?
Yeah, that's a great question. So, yes, honestly, so I've been doing this for like 3.5 years. Really, like I would say at an expert level for about two. Expert meaning like I finished my mentorship, but then I've done like a million other courses and I've seen hundreds of patients at this point. So, um, for the men side of things, I've seen it decline rapidly, but I've also seen more attention on the male side increase. So is it like, has it been declined rapidly, or are finally people waking up and like getting tested for sperm earlier? And not people meaning like the patients, like doctors, like are we
Mm-hmm.
pushing and promoting more like education on like sperm health matters too? Um, and people are more focusing and more aware of it now. And so is it just like I said, maybe it's a combination of like, okay, there are a ton of environmental toxins going on. Testosterone's really low. There was also a push for a while for like men to be on like TRT or hormone replacement therapy, right? Testosterone
Mm-hmm.
replacement therapy is literally, I call it the male form of birth control, right? So there's a long story short, maybe awareness, maybe also mixed with the environmental toxins exposure, and then maybe also mixed with, this push for TRT in men for a while. It could be this combo. Because I
Mm-hmm.
definitely see a mix of all of that. Um, but yeah, it's been kind of crazy actually. And so it's definitely really important to get a semen analysis done.
Yeah. And I was going to ask, so with the semen analysis, what is it all going over? So like if a patient, like a couple comes to you and you're treating, both of them, is that like just for everybody? Like a semen analysis is just done no matter what?
Yes, I would always say like baseline, everyone should get their hormones tested, their gut health tested, and then for men, a semen analysis should be done. So those are the tests that I like to have done, like I said, for baseline. And then from there, obviously you can do more specific tests. So for semen analysis can be done where you're just looking at like, concentration, volume, motility, morphology, progressive motility, things like that. And then there's a more complex one that can also look at DNA fragmentation. And that's actually the value that's more so linked to miscarriage or loss, right? Because DNA fragmentation is actually showing us like the quality of the DNA in the sperm versus just like the shape and like can it swim forward and is there enough, right? So there's kind of layers to that. DNA fragmentation, obviously, like everything else, is going to be a lot more expensive to test, right? Because it's not like a basic or baseline test. But if people have recurrent losses, I definitely recommend them get that looked at.
Yeah. So, and like losses, would that normally happen like early on? Because, there's people that I know that they're like, oh, I'm pregnant. And then a week later, they're like, I miscarried,
Mm-hmm.
so it's almost like the eggs getting fertilized, but then it's not sticking. So it's like it like amps up those HCG levels. And then next thing you know, you're not pregnant. So do
Yeah.
you think, I mean, that could be like, I mean, like you said, everyone's different,
Yep.
but that could definitely be from like the sperm DNA.
Yep. That could absolutely be one of the causes. Also, clotting factors, also low progesterone, inflammation, low vitamin D and ferritin, thyroid issues. Like it could be a lot, but for ruling things out, it could also be a combo, right? So, yes, we
Yeah.
could test the thyroid and it could be due to thyroid health, but what we should still make sure DNA fragmentation is okay, right? Because what
Hmm.
if it's thyroid and DNA fragmentation?
Yeah. No, absolutely. Now with women and the thyroid,
Hmm.
and like PCOS. I feel like I'm seeing that everywhere. And like you said,
Yeah.
maybe it's because it's just being talked about more, but like three or four of my friends have PCOS. And I'm
Hmm.
like, how is this? Why? Um, and so is it really stemming from the gut? Because I hear so much about leaky gut. What is it? H. pylori? Is my saying that
Hmm.
right?
H. pylori, yep.
And is that like bacteria, H. pylori?
Yeah, bacteria that lives in the stomach.
So, I mean, to me, I'm like, you know, I feel like it's all coming from the gut because the gut is like, don't they say the gut's like your second brain or something like
Yep.
that? I've heard of that.
Mhm. Yep.
Um, so when you have someone come in, like, you know, a woman come in and whether she has like thyroid or PCOS or, you know, just not getting pregnant, what gut testing is done? Or does it, you know, and does it shift depending on what symptoms they're having, or is there like one that you like to go to specifically?
Yeah. Well, first, I do wanna just touch on something with PCOS is
Yeah.
it is being diagnosed more, but I find so many people are now misdiagnosed. So I have so many people that come to me that are like, "I've been diagnosed with PCOS," which is good that, like, other practitioners are looking for it now because for a while it was just, like, ignored. But again,
Yeah.
kinda like with the thyroid, now it's, like, being overdone a little bit.
Yep.
And I'm like, "Well, what criteria did they say?" And they'll be like, "Well, my AMH is a little high and my LH to FSH ratio is off," but, like, nothing else. They don't have cysts on their ovaries, they have a regular cycle, they have no high elevated androgens, their insulin's fine, or their insulin's off, and then they're just told they have PCOS. Like, they're not meeting the criteria, which the specific one's called the Rotterdam criteria. And you're supposed to meet 2 of 3, specific things, and that is that you have cysts on your ovaries, that you have an anovulatory cycle, meaning you're not ovulating when you have your period, or you just don't have a period, and then that you have elevated androgens, whether that's symptoms such as, like, hair loss on the hair and hair loss on the head and hair growth other places, or um, you know, you have the actual elevated labs like testosterone and DHEA are elevated. Though if you have 2 of those 3, you can be diagnosed with PCOS. Other than that though, you might have a PCOS like symptom or a PCOS like picture, but it does not mean you have PCOS. And that is getting lost, like major. Like I mean, I don't agree, like, all these criterias, like, I also believe that there are different versions of PCOS and, like,
Yeah.
maybe everyone doesn't fit in a box, but people are being told they fit into this box, and then they're given, like, metformin and all these other things that, like, they don't need. Like, I'll have people be like, I was diagnosed with PCOS, and so because of that, they told me being on metformin will help me conceive, but they've never had a history of glucose or insulin issues. And I'm like, well, now you could drop into hypoglycemia where your blood sugar is going too low. That can actually be really dangerous. And like no one's checking that. And it's just been studied though that metformin helps with PCOS, but like why? And
Yep.
it's because of the insulin levels. And so, sorry, clearly I feel strongly about it. I was like, I need to address
No.
this.
No. I love to hear this because I'm like, you know, I'm like, am I going to be the one that's next? Like, literally, I'm like, I was talking to my husband. I'm like, oh my gosh. And I'm naming all my friends off and I'm like, they all have PCOS. Like, why is this? You know, and like, my
Yeah.
thought is, why? And then, yeah, I've heard the metformin. And then it makes me think too, like, are you just going to be on that for the rest of your life? Like, is that the solution? Um,
And absolutely not.
and like you said, it can cause other issues then.
Oh, yeah. I mean, and that's if you don't need it, but if people want you to be on it, I mean, one, most of the time you can lower your insulin with diet, lifestyle, and then maybe some insulin supporting herbs. Maybe you just need a inositol. Maybe you do need some other blood sugaring support herbs, but like most of the time, you don't need metformin. Um, Metformin has been studied and had been proved to help because it lowers your insulin, but you can lower your insulin many different ways, right?
Mhm.
So it doesn't mean like metformin equals pregnancy. And then, you know, you need to continue to manage your insulin once you are pregnant. And we don't want to be on medications when you're pregnant. So if we manage to lower insulin without that, that's going to be ideal, right? Because then
Yeah.
you can also go into pregnancy and reduce risk of gestational diabetes and things like that because you've already learned the diet, the lifestyle, and you've been able to get it down without the help of medication. And I get it, people with PCOS, I don't want to like take away that they're like, I've done the diet and lifestyle stuff. There are things like herbs and supplements that can lower it without the side effects of metformin.
Yeah. Um, I've heard a lot about now what's NAC? I think that's like an
Yeah,
acronym.
NAC. Yeah,
What is that used for? Because
excuse
I
me.
see that everywhere, you know, and I'm like, what
Yeah,
is it?
yeah. So it's N-acetylcysteine, and essentially, it is a really big player in it's going to basically reduce reactive oxygen species, help with inflammation. But I mean, it's great for so many different things, from like egg quality to if you have a cough or a cold. Honestly, it was used a lot like during COVID and long COVID to help with respiratory issues. It can also help with cervical mucus. Like, it is a great one. It's kind of like a treat all. Same with like CoQ. CoQ10 is honestly not even as great as NAC, but CoQ10 is still awesome. Like, it's still great for egg
Yeah.
quality and things like that. It's just NAC like even goes beyond. But I give that one to most people who I need to work, like with egg quality, those who've been diagnosed with endometriosis or PCOS or something like that.
Good to know. Yeah. I'm asking because I'm like, I see it everywhere. I see it when like people are trying to conceive or when they have certain diagnoses. And I'm like, what is it?
Yeah, it's
um,
wonderful.
yeah. Um, it sounds like it. When someone comes to you and, they're like, hey, I haven't been able to get pregnant or I've had multiple losses. What does like an intake look like with you? And do you treat only in Arizona or can you treat remotely from people from different states?
Yeah. So first off, an intake, it has a similar backbone, but obviously can like change from person to person. But
Yeah.
essentially, I like to hear everyone's story. Then I like to, review like what they have done for fertility, things that they've tried, they haven't tried, how it's been for them, right? Like checking in emotionally. And then I do go into like the menstrual cycle details, everything from like, is it regular, to how many days, to what do your bleeding days look like? How many tampons do you use during your heavy days? Like, very, very detailed.
Yeah.
To other symptoms too. So obviously, do you feel cold at night? Do you struggle with fatigue? Do you have cramping? Do you have bloating, etc.? And then we also go into like family history, medical history, and then I do dive into diet and lifestyle, see where they're at with their overall lifestyle choices. And then we kind of round out with like what our next steps going to look like usually. Those are really quick overview, but when I see two people, we start on our first visit with 90 minutes. If it's one person, it's 60 minutes. And then so I have patients in Arizona and Washington because those are the states I um, have my like actual medical license in. And then I can see people as like a consultant in other states, but I'm not doing the medical stuff as like, you still get my brain, right? Like, you still
Yeah.
have my brain. I still like know all of the stuff, but like, I'm not going to be prescribing you medications. I'm not ordering labs for insurance. We can talk about cash pay labs and how that can happen, but I'm very strict on like what I can do in other states. And if you have questions about that, I always tell people just to book a consultation to talk about it.
Yeah, absolutely. So the patient has to be residing in Washington or Arizona, like be a resident in order to kind of have you be their doctor per se and like write prescriptions.
Yeah, to be more as like an active doctor, and to also like talk to them about prescriptions, right? Like, if you're in a
Yeah.
different state, I'm not going to be the person like weaning you off a medication. I might suggest that you talk to your doctor about it, but I'm not going to be that definitive person in that.
Yeah. And have you had a lot of women come to you or do you primarily treat women? Do you only treat men most of the time when like you're treating like a couple? Or
Yeah.
do you have men
Yeah.
that, yeah,
I do have some men that I see by themselves, especially if like the female side of things I feel like is really dialed in, and like they keep getting low sperm results, or semen analysis results, excuse me. But most of the time it's in a couple fashion.
yeah. And so when women come to you, um, and maybe, it can be for anything, but they're on medication, you are able to work with them with getting them off certain medications, correct? It's not all the time, but you'll run the labs and then you're able to put together like a treatment plan.
Yeah, and like you said, it's going to depend on like what medications they're on, why they needed it, what was the reason they were put on it. Like, people who are put on metformin and they have no history of an insulin issue, we talk about getting them off that as soon as possible, because I think that's really bad medicine, actually. I think that's almost dangerous. And other ways we can help them, like lower their androgens or whatever it is. But um, yeah, we definitely go into conversations about that, but I'm never like stop everything immediately. I feel like that
No,
would also
yeah.
be very dangerous. Yeah, so
Yeah.
I'm pretty understanding too. If also people are like, I want to stay on it, I'm like, great, we'll just continue to monitor, and then if your like values are showing like, oh, we're doing too much for it, we can talk about that then.
Yeah, absolutely. Yeah, I know that. I mean, I haven't, like I said, I haven't had to get off anything, but should I needed it, who I see there, she's like, hey, if you needed to be on this medication, I would put you on it. And then we would work to get you off of it if that's not your goal. She's like, I'm not going to be
Yep,
treating you and see that you need something and just disregard it either.
yep,
Um,
yep.
so as far as certain tests, so kind of diving into like a gut test, like how is that, like a blood test, or how is that measured? Like how is all the bacteria measured in your gut,
Yeah, I'm
or
so
just
happy you
different
asked
stuff in
about
your
that.
gut, I guess. Sorry.
Yeah. No, no, don't be sorry. I'm glad you asked about it again because we were going to talk about that, but then I got like on a tangent for the PCOS. But I really like a stool test called the GI map. It's by Diagnostic Solutions. I know I do not get paid anything by them. So that's not a plug. Some people will say they've heard some not so great things about those tests if they start researching it. I have done a lot of research and spent a lot of time finding tests that I think are best. And there's a lot of reasons why people have said that, but let's just say the people who've been very vocal about it are probably going to be legally in trouble soon. So, I mean,
Yeah.
like I said, I'm not on the diagnostic solutions team, but there is a lot of like false information being spread. And honestly, no test is perfect. No test is going to be 100% correct all of the time. But this one I do believe works really well. And I see really good results when I treat from it, like very good results. And so that's going to be my favorite. And it tests pathogenic bacteria. So basically, bacteria that you can contrive from, eating a contaminated piece of food and drinking contaminated water. It's going to test for H. pylori. It's going to test for your commensal bacteria, so your good bacteria that everyone talks about. It's going to test for candida, parasites, viruses. It's also going to test for intestinal health markers. So it's going to check for occult blood, which is kind of like dark blood in the stool that you can't really see with the naked eye. It's going to test for inflammation markers. It's going to test for digestive enzymes. And it can even test for markers that show like leaky gut, as a lot of people know.
Yeah.
Yeah, so
Yeah.
it's
I feel
very
like,
comprehensive.
yeah, it sounds like it. And I don't know if part of me, I haven't done one. I've thought about it and then I'm like, I'm kind of scared. Like, what if there's stuff that, you get back that you're like, oh my gosh, this has been going on. Like, I'm scared. Like, can you treat? I mean, you can treat most of what you find
I've
when you're doing a GI map.
Everything that I've found. Yeah. Everything that I've found, I've treated. Sometimes it's a little bit more complicated and you have to like try again, or you also have to do another test to make sure there's also not a SIBO issue, which, right? Small intestinal bacterial overgrowth, which is something else in the gut. The GI map could indicate it. It doesn't ever say like yes, positive or no clearly, at least not from what I've found. And so a lot of times like taking that one step further and
Hmm.
also testing for SIBO can be helpful. But yeah, most of like pretty much everything can be dealt with unless it's like a chronic like IBD, like a Crohn's or ulcerative colitis, right?
Yeah.
That's a different story though. But even then, I have helped people manage symptoms without having to go on crazy medications, which is
Hmm.
awesome.
Would you say that a lot of it is diet when you're treating the gut? I mean,
To be
if it's
honest,
not
no.
bacteria, no?
So it's more diet's more about maintenance and like keeping the gut healthy. There are some people who will say like you can really work really hard on diet and lifestyle and it does get better. I'm more of the like we have to treat with like herbs and like supplements, get it in the correct place and then maintain good gut health with diet. Diet's still very important. I just don't think it's the only thing that should be done when it comes to treating the gut.
Absolutely. Now the SIBO, how does one contract SIBO, or how does that happen?
It's a really good question. I would say most gut issues are in general from a lot of times chronic antibiotic use. So if you used antibiotics a lot in the past, most likely you're going to have some issue with candida or SIBO or something like that. Not all the time, but like I know myself, not to overshare, but like I was on tons of antibiotics when I was little before my mom found the natural route, but I've struggled with candida on and off forever. But I know that's because my gut bacteria was wiped out when I was little, like 100%.
Mhm.
So I work really hard at maintaining gut health, but um, yes, that can be a primary cause. Also, stress. So stress weakens our gut, it weakens our immune system, and that definitely allows space for things to go awry in the gut, right?
Mhm.
Environmental toxins exposures, foods that we eat, lack of fiber intake. So definitely we have control over what goes on in our gut, but sometimes we can't help it, right? Like also
Yeah.
H. pylori, exposure to H. pylori can happen many different ways, but it is exchanged through what we call as scientists the fecal oral route. But essentially, that just means like if your partner also has it, you can get it from kissing them, right?
Oh,
Um,
wow.
yeah. So a lot of times, like if I find H. pylori in one person, I'm like, we're definitely testing in another person, in your partner.
Wow. So
Mhm.
can somebody have H. pylori and for years and not even know it? Like it can just
Yeah,
live within,
honestly.
and it lives within your gut.
Yeah, and because it can, every symptom is different, right? So it lives in your stomach. It actually decreases your stomach acid, so it can cause things like heartburn. It can also lead to other issues, right? Like SIBO, like candida, like bacterial overgrowth in general. Um, and it can be subtle, right? Like you can get heartburn sometimes. You might have
Mhm.
some acne. You might have bloating. And a lot of times those are not always linked to H. pylori, so it's missed. In addition, H. pylori testing. So when you're testing H. pylori, there's a few ways to do it. The way I like to do it is through a stool test. Most practitioners do it actually through a breath test, which isn't bad. It's still a good test, but a lot of times I find that like I'll still get positives on the stool test, even though it was negative on the breath test. And then when we treat according to the stool test, people get better. And it can be really subtle symptoms
Mhm.
that don't seem like it would be to do with gut, but it was, right? Especially
Wow.
with fertility. I just posted a whole study about H. pylori, but fertility and H. pylori, it's really important to rule out.
Yeah. No, well, I was reading that actually. I was on yours and I've seen it other places as well. And like, forget who it was. There was like an influencer that was like having trouble getting pregnant. She got tested, found the H. pylori, cured the H. pylori, got pregnant. Um, Birth control. So this is interesting. When I was at, and maybe she's wrong, but when I was at my doctor, she was talking about leaky gut and she's like, based on what I'm seeing from like your blood and from the, all this stuff, she's like, you have leaky gut. And, or she's like, I can at least guarantee, most likely that you do. And she's like, were you ever on birth control? And I was like, yeah, I was a long time ago. And she's like, if you are on birth control, then you most likely have leaky gut. And I'm like, this is news to me. What are your thoughts on birth control and like the gut?
Oh, yeah. Birth control, yes, absolutely. A major cause of any gut health issue, right? I mean, yes. Long story short. But most medications, metformin, steroids, Ozempic, the GLP, right? Like pretty much most medications wreak havoc on the gut.
Yeah.
Most. I'm not going to say all, but most, right?
Yeah.
And so if you have been on medications or any like for any particular reason, even like right, like SSRIs and I would just get your gut checked. I personally think everyone should get their gut checked like once a year at least. That's my personal opinion.
Yeah. I'm with you. I mean, like I said,
Yeah.
I've
After
been
hearing
I've
this.
been teeter. Yeah. Well, I've been, my doctor really wanted when I saw her last, she's like, I really would like if you did like the GI map. And she was telling me all about GI map. And she's like, I just think there could be a lot of benefits. Like we have answers, but we can get even more answers. And so I've been definitely teeter tottering, but yeah, now talking to you, I'm like, I have to do it.
Oh
Because
yeah.
yeah,
I would do it.
I mean the bloating, and people just walk around like, oh, my stomach's bloated. Oh, I ate this and I know this is causing me to bloat. And it's like, no, it's not probably that food. It's the way that your gut's reacting to that food that you put in, but there's something more going on. There's a bigger story. Um,
Yeah. What's the root cause?
yeah. Honestly, what's the root cause? Um, with leaky gut, how, like, what is like a treatment for leaky gut? Is it herbs, digestion? I mean, it's probably a whole path, correct?
Yeah, and I have a very specific thing, like if we see the markers of leaky gut be present, right? I really like powders that have specific herbs in it. Glutamine's a great one that also helps with like right inflammation. But again, like based off your numbers and your values, like make a difference too. Like how is leaky gut presenting? Do you have also like a secretory IgA that's high or low? If it's low, we probably also want to dose with immunoglobulins. Like there's a lot that actually goes into that.
Mm-hmm.
But to be honest, like I do recommend actually healing that. Like I think you can do a lot again with diet and lifestyle, like fibrous foods, polyphenols. So that's like berries and stuff. Those are going to be really important. Um, Even like a probiotic can be helpful, but sometimes we need that powder to what I call like heal and seal, right? We want to like coat and heal and seal everything.
Yeah. Yeah. I rather drink like a tea or take a powder than take a bunch of pills, like supplements. Um, that's just my personal take on it.
So I'm happy you brought up because I like totally forgot to say that.
Oh my gosh. Yeah. Um, I like started going around telling everyone that I knew. I was like, "Were you on birth control? You probably have leaky gut." Oh wait, this is what I wanted to talk to you about. So when it comes to birth control, like obviously there's like the oral, birth control pill that you take. Now what is this thing that people are inserting in them now that they're getting inserted? Um,
Like an IUD.
yeah, IUDs. What are your thoughts on IUDs? Because my mind, I've obviously, like, when I was on birth control, I took a pill. That's just what I did. I got off of it when I was like 21 years old. I'm like, I just don't want to be on this anymore. I know it's bad for me. But now the new thing is these IUDs. And, I had someone explain this to me one time, and she was talking about how she has an IUD and she got it changed. And she's like, "Oh, it's so painful." She's like, they literally, like, your scar tissue starts growing around the IUD and then they literally like rip it out. And I'm like, how is this healthy?
Right.
Like,
How is that
what is
good?
that doing? What is that doing down there? If the scar tissue is growing around it and then you're removing it to then reinsert it. And she's like, it's so painful. I'm like, why would you do that? I get why you're doing it. But I would think like there's tremendous damage being done. Um, So, have you had, I mean, obviously you can't disclose certain information, but like, I mean, do you think these IUDs can be causing issues with fertility later on once these women get off of the IUD?
Yeah, that's definitely a loaded question because first off, right, there's multiple types of IUDs. I almost said IUI. I talk about IUIs a lot. Um, IUD, right? So there's the copper and then there's like the Mirena. I would say those are like the two big ones. There's also like Kyleena and Skyla. They're like smaller versions of the Mirena. But essentially there's like hormonal based IUD or copper. Copper, I'm pretty sure is the one that your friend was probably talking about because copper IUD causes inflammation in the area, which is more likely to cause that scar tissue. Now, could the Mirena also? Probably because it is inserted um, in your body,
Mm-hmm.
but it's a little less inflammatory. And so I'm assuming that that one's probably not the one she was talking about. But either way, the copper one, yes, I used to think it was better. This was before med school, and I used to think it was. Everyone around me thought it was because it's like, oh, it's no hormones, right? But then the more you learn about it,
Mm-hmm.
like I'm learning about it in school, and I'll never forget being like, what? What gave me the idea that this was better? Like literally, the mechanism is that it causes inflammation in the uterus. Like
So
what?
it's not using any hormones. It's just causing
Yes.
inflammation to then block, essentially.
Well, it's first off, it's used as like a physical block. So like that
Mm-hmm.
sperm can't get up, the cervical os, right? So it can't go to where it needs to go. Then it causes inflammation, and then they also say it can change like the pH a little bit. So it's like a kind of there's a couple mechanisms. The first one though is that it is a physical block, but it does copper does cause inflammation there. And then like people are allergic to copper and they don't know about it. So it can be like a mild allergy, but super irritating in the uterus. So there's a lot of things with it. Essentially, the more I've learned, honestly, I would say my favorite method of birth control, if need be, is going to be the Mirena, or like the hormonal IUD. One reason is it normally doesn't cause as inflammation. It's not acting as like a physical barrier, so it's also smaller. And then its hormones are produced locally, so it's usually not stopping ovulation, which is something we actually want to continue. So every other birth control is going to stop ovulation, and the Mirena can, but a lot of times it doesn't. And so if we're going to be something like that would be my best choice. Obviously, if I could really shoot, like if the best choice would be just tracking your cycle or using like a
Yeah.
barrier method. But I definitely think that the copper is the one that like we all thought would be like great because it's not hormonal, and then it's just like, whoa, the more you learn, it's just like, okay, my eyes are being open to this is not as good as I thought it was going to be.
Yeah. And I just learned something as well. So anytime you're on birth control, you don't ovulate. So
Nope,
even
it's
if
that
you're, sorry, go ahead. Like when I was on my birth control, I was from like 15 to 21. I still got my period, but
yeah,
I
but
wasn't
it's a fake
ovulating.
period.
Interesting.
Yep. Yep. It's why you can't get pregnant. So your body is creating it's you're given your other hormones, right? And you're not
Uh-huh.
given progesterone. A lot of people think you're given progesterone. You're given a progestin, which is going to act very similar, but it's still different. Um, and it's one of the reasons, though, why like most women don't feel great on birth control. Some people do, but most women
Mm-hmm.
don't, and it's because we're replacing these like good hormones with ones that are just a less effective version of them. But if you're giving yourself the fake hormones, your body's not signaling to do the same things, right? So
Wow.
essentially, it's like a fake period. That's why, like, practitioners will be like, doesn't matter if you have your period when you're on birth control or not, which is kind of true. I mean, every once in a while, it might be nice to have a lining shed, but it's not like a real menstrual cycle includes ovulation, and that's not what's
Yeah.
happening.
Yeah. Well, I never knew that.
Yeah,
And
it's
it's
wild.
like, it's crazy because I mean, yeah, like I literally was put on it because like, I don't know, I had like raging hormones as a teenager and my mom's like, we need to fix this. And the doctor's like, let's put her on
Yeah,
low birth control. Basically, that's why I was put
yeah,
on. And then I stayed on it. And when I was 20, I'm like, I don't want to be on this anymore. And it was crazy too, because the doctor's like, well, do you want to get pregnant? And I'm like, no, but I also don't want to be on this. So I'm going to get off of it. Um,
right.
wow. That kind of blows my mind. So your body is your body then shedding like lining still though? Or like,
Yeah, so if you are having a period, you can shed. And a lot of people will get like breakthrough bleeding because their body like just needs to kind of shed. And that's why they'll say it's
yeah,
like technically not necessary to have the period when you're on birth control, but also it could be nice to have that lining shed. Um,
yeah,
but yeah, most of the time, I mean, like I said, it's your body kind of like this is why I call like TRT the hormone, like the equivalent to birth control in men, because if your hormones are being produced and your body is just given them, it's not going to create its own anymore, right? Testosterone has a negative feedback loop. So if it's given testosterone, the men's testicles are not going to secrete testosterone. And if the testicles aren't making testosterone, the testicles are not making sperm. So it's a very simplistic way of putting all of this, but long
yeah,
story short is like that's why when sometimes like when people just give hormones to people, I'm like, that's not necessarily the fix because yes, you might be helping in some capacity, but like we're teaching our body to not do it on its own. And my goal is always to try to nourish the body, to teach the body how to do it. And that's why I love herbs
mm-hmm,
because the herbs help teach the body. They're not just giving the body what we feel like it needs. Right.
yeah, exactly. So
Sorry,
now
that was
why
like a
would
total
like,
tangent.
no, it actually made me wonder like, now why would a man be put on that or why would they take that?
Yeah, so testosterone replacement therapy, does make men feel pretty good usually. So a lot of times men nowadays have testosterone pretty low. I like testosterone at least at 600. It's very rare where I see a man at 600 now. I mean, granted, I see a population that's struggling with fertility, but still. Um, and so a lot of men just go on TRT because it's easier. And everyone's like, oh, your TRT is low. Let's just put you on it. Most men feel really good for a period of time, but then it like stops working or doesn't work how it used to, even though their levels of testosterone are super high. But again, like it's just different when you can make it. I always say it's better to make it than take it.
Mm-hmm.
And so men are just being put on it because it's a simple solution, right? It's a simple solution that's relatively seems healthy. But what's wild is they're not told the effects. Like most men don't know when they go on it that it can impact fertility, which blows my mind because that's a really big side effect. Because like
Yeah.
some men, most men can get their levels back, but some men never do. Their sperm levels never recover. So it's like that's a pretty big thing to leave out, right?
Yeah.
Some men, it's very, very rare, but I have seen some men be okay with their levels. I think their levels were just so high before going on it that it wasn't an issue, but that is like very, very rare. I don't have a specific percentage to give for that, but most of the time it's going to impact. And in a great way. Like to
Mm-hmm.
the point where if you're on it for at least like 6 months, I've seen people come back with zero sperm. Zero. Like not even
Wow.
low numbers, zero. Yeah. What
Oh
we would
my
call
gosh.
azoospermia. Yep. And so it's like blows my mind again that like this isn't a conversation, but it's so big right now. And that's why
Mm-hmm.
I'm probably emphasizing it right now is because I'm just like, it's so big and no one's being told this. And it drives
No.
me crazy.
Yeah. No, that's really crazy. And so then you
Mm-hmm.
probably have couples coming to you and it's like, oh, well, you don't even have sperm. So,
Mm-hmm.
you're basically trying and nothing's being done because there's nothing that can fertilize that egg.
Yep.
Um, wow. And sometimes men can't even get back to it if they've been on it for so long.
Yeah, it depends on the length of time, definitely, and the dose, right? So, like, people can be on it for a long time and a lower dose, they're probably a lot more likely to bounce back. But if, like, people have been on it and they just keep going up and up because it was losing its effect,
Yep.
yeah,
I was going to
it's,
ask that
mm,
when it loses effect,
yeah,
are they just like, hey, we'll give you more, a
yep.
higher dose?
And it's wild because also, like, most men, again, like I said, start to not feel great on it anyway again. It, like, helps a little bit in the beginning and then they, like, cling to that. But I'm like, most of the time we can get the testosterone up naturally, but it does
Yeah.
take more work. It takes more time in the gym. It takes being mindful about your stress. It takes being mindful about sleep and what you're eating and what you're drinking. That matters. And men, specifically for them, their body composition matters a lot for testosterone. So, like fat to adipose ratio, or excuse me, adipose to muscle ratio, right? So, fat to
Mm-hmm.
muscle.
Hmm. Like the quality of their sperm. That's what matters is their fat to the
Well, it
muscle.
matters. That matters. Yeah. Well, I mean, it will help with the quality, but it mostly matters when it comes to the testosterone.
Okay. Got it.
Yeah. So a lot
Wow.
of times, like again, men just get on TRT, their testosterone goes up, and then they're able to lift heavier weights and they feel better overall. But like what they should be doing is focusing on the foundations first and going to TRT at last resort, or maybe using it to like jumpstart things and then get off it. But most of the time, it's not going to be like the big problem solver
Yeah.
for people. Yeah.
Um, so when you have like a couple or even just like a woman, coming to you and being like, hey, I'll just throw out a scenario. Like, I've been trying to have a baby. We aren't successful and it's been like a couple years. W- Are you finding like a trend or is it just different amongst all of your patients? But, or when I ask for a trend, like, is there a trend of what you're seeing is helping or like the root cause to this infertility?
Yeah. So I do tell people if I had to pick a test, the one test I would choose is the GI map. So I
Okay.
find that like if we work on gut health and we heal gut health, things get a lot better for everybody. And I see amazing success rate with that. I used to do hormones first and then gut, and now I'm like so flipped. Now
Yeah.
I'm so much more invested in the gut health. And so I do tell people that um, it it tends to be like a root cause for like overreactive immune system or thyroid issues, or we're not absorbing micronutrients, right? What about ferritin and
Hmm.
vitamin D? Or our hormones are a little imbalanced, but we have a ton of inflammation going on in the gut. So a lot of times, like if we're missing that, our hormones are not going to rebound the way we want to. Yes, the herbs can help it, and I've seen it help it, but honestly, treating the gut is like my favorite thing right now.
Well, and like you said, if you go to treat the hormones, but the gut, you have leaky gut or those nutrients aren't being absorbed properly, then like you're not going to have the best success. So it's like I understand with the gut. I mean, I'm starting to learn more and more about the gut
Yeah.
by just doing my own research. What are your thoughts on red light? I'm seeing red light therapy everywhere for like inflammation or like I guess maybe it's red light and infrared um
Yep.
together. What are your thoughts on treatment using that as like a form of treatment or like with
Yeah.
other treatment?
So I had a fellow practitioner, and I'm like totally spacing on who it is right now, but I want to like give them credit, but I'm going to butcher what they said anyway. But long story short, they said like something about the amount of money that you spend, or as much as you spend on, these tools like the lymphatic drainage plates and, colon hydrotherapy and like all these things, red light therapy, it's not going to matter if you are not doing the basics. So like red light therapy, infrared, those things can be great and can help promote healing,
Mhm.
but you still need to sleep. You still need to work on your stress. You still need to move. Those things are going to they're not going to touch it if you're not at your optimal. Now, if you're functioning at like your best with diet and lifestyle, you're at 80/20. Those things can be great. They can help with your skin health. I mean, help, uh, it can make it more like vibrant, right? You're returning over cells. It can help with thyroid health, right? It can do these things, but not if the foundations aren't there. It's not going to
Yeah.
do much, if I'm being honest. Um, so yes, there are great benefits, but we also need to make sure we're taking care of the other stuff as well.
Yeah, kind of like you mentioned earlier with like diet helps, but you need to be treating what's going on in the gut first and then the diet kind of it's maintaining. So it's more of like a
Mm-hmm.
maintenance, would you say,
Yeah.
tool?
And I mean, like, well, but red light though is even, yes, it's probably more for maintenance and to help you achieve a beyond optimal, right? Like optimal is for us. When I say optimal though, it's like basically what we should all be striving for health. If we want
Yeah.
to kind of like biohack or go even above that, red light therapy is used for a lot of beauty, but it's also used for pain. It's also used for thyroid health. It's used for a lot of different things. But that is when I'm like, that's what we want to do, is when we want to like create even a better environment than we can. Like I use red light therapy on my face a few times a week but
Yeah.
that's vanity. That's like,
Yeah.
but that comes after like that red light therapy is not going to make that big of a difference if I don't wash my face every morning and night. If I wasn't using some of the serums, if I wasn't treating my gut, like I just had to treat H. pylori on myself. Like my skin was I was breaking out a little bit. Now I'm not really breaking out anymore. I wonder why. Right? Like
Yeah.
it's all of these things that like the red light therapy is not going to make a big difference if I didn't treat the H. pylori.
Got it. And
Mhm.
how while we're on that topic, how do you treat H. pylori? So when I've like read about it, it looks like there's like basically, is it an antibiotic or what treats it?
Yeah, so there's a few ways you can do it. You can use an antibiotic. I use herbs specifically, but everyone's going to be different. And then also, like a lot of times, H. pylori is accompanied by other things going awry. So then you just want to make sure you're also treating those added things,
Yeah.
like a leaky gut, low digestive enzymes, things like that.
Now, when you're saying herbs, are you taking supplements? Are you doing teas? Like in what way do you like to treat? Or once again, based on patient preference?
Yeah. Sorry, one of my AirPods died.
No worries.
So I'm going to charge it. But for treating the H. pylori, definitely patient preference comes into play. I do really like tinctures and I do like capsules. I do like teas, but that has to be for a patient who really likes tea because you have to drink a lot of it for it to be medicinal. Um,
Hmm.
like at least 3 to 5 cups. And so I love tea. So tea could be definitely a way for me to do it. but tea in the wintertime versus tea in the summertime, right? Like I'm probably not going to drink 3 to 5
Yeah.
cups in the summer, maybe 1 to 2, but like in the winter, yeah, give me 5 cups of tea to drink a day. I've done it, right? But I will say I definitely do like a mixture a lot of times between tinctures and capsules.
Okay. And
Tinctures are
that's, and
liquid, by the way.
yeah, they're like different. How do you describe a tincture? Like I know, I mean, I've seen them and like there's like different stuff in them. So is it like a mixture of herbs created and like those herbs together treat certain stuff?
Yeah, yeah, yes, and then they're, um, basically the medicinal properties are either drawn out via like an alcohol solution or a glycerin. Glycerin's obviously gonna be a little bit sweeter. Alcohol, I think, tends to be a little bit more potent, but glycerin does work well. It's just like for people who do have like elevated, um, issues with glucose and like insulin, I do prefer more of the alcohol solutions. Um, but yeah, it's pretty cool. We actually used to make the medicine even when we were in school.
Oh,
Now I
wow.
just give it via full script, but yeah. No,
Yeah.
when I say like we study these herbs, like it's a different level. Like we are in clinic, we're making them, we're making even concoctions to see which work better. We're trying them. Like everyone talks about how naturopaths are, or we talk about it at least. We're like immune to also like the taste of certain herbs because we've like had to try all the grossest ones in lab and stuff.
Yeah. I've heard a lot about like bitter herbs and how those can heal like digestion. That's really the only time I've actually heard of like herbs and healing. But it sounds like from what you've mentioned herbs a few times. So it seems like they're definitely super powerful in healing.
Yeah, and I actually classify them as different as a supplementation, right? So I think of a supplement as like you are supplementing with something that we don't have enough of, right? So like magnesium, vitamin
Mm.
D, selenium. An herbal remedy, I classify, I mean, it's still technically under the umbrella of a supplement in today's world, but like I do think of it as a different thing because those are giving you something that we might need more of. Herbs are kind of helping you either eradicate something we don't want, achieve a certain level of, hormone, but it doesn't give you anything. It helps your body do it, or like in the H. pylori case, like kills the H. pylori. But what's nice about herbs is like compared to an antibiotic, it's not crazy detrimental to anything else that's going on unless you have
Hmm.
someone who's like completely dosing you incorrectly. But like safely done, they're wonderful because they don't cause the damage that like medications will
Yeah.
or have the same side effects, right? Like there's also that.
Yeah, I know. I mean, anytime there's a medication, I mean, there's like, even when you see like a commercial on TV, I'm like, why would anyone take this? And it's like some of the stuff is scary. It's like, oh, you can have a heart attack, a stroke, a lot of times I feel like that's overlooked, but until it happens to you or someone close to you, and then you're like, oh, wow, those warnings are there for a reason. They do happen to
Right.
people.
Yeah, they would not put them on there if they didn't happen, right? Like a
Yeah.
big one, just because we're talking like fertility a lot and hormone, like Clomid's one. I feel like it works really well for men, but for women, I just see that they deal with a lot more side effects than men. And this is crazy because women are never told this, but one of the side effects is that you can have like blurry eyesight and it can last for an extended period of time. Like I have people who come to me who tried Clomid and they've had like halos in their eyes
Oh my
for like
gosh.
months and months.
And is that
And their
like a
doctors are like, it
fertility
should
drug?
resolve. Yes,
Is
Clomid is a drug that can help people ovulate. It's
okay.
given a lot in like PCOS cases or someone doing an IUI. It can be, like I said, used for men and women, but like that's one that like no one talks about that. That is not, it's not often that it's happened, but it's happened enough to where I've had at least 5 patients talk to me about their eyesight after
Oh
Clomid.
my
So I'm
gosh.
like, that's wild, right?
And your eyes may never go back. Like it could have permanently done damage.
Yeah.
Like you never
I
know.
for so
Case by
far the ones
case.
that I've had, yeah, it's been fine, but the docs are like, I don't know, we don't know like how long will take. Like it might get back together. One of them was like one eye is totally fine, the other is still having issues, like a lot of halos. And I'm like, that's wild. Like
Yeah.
but that's
That's
not
really
told to
wild.
someone because that's a
Yeah.
big side effect that does happen.
Yeah. I mean, they'll probably say like, oh, it's listed on there. Okay. Who gets their prescription and in tiny print, God knows what size it is. You're reading
Yeah.
through everything. Cause I don't know anybody that does.
No, I mean,
Um,
no one's ever, I didn't even read my birth control stuff, like,
no.
when I was on it, I don't know, however many years ago at this point, but I never did.
Well,
And I was still interested in natural medicine. I wasn't a doctor yet, but I was still
yeah.
interested in it. So I'm like, I can't even imagine.
Oh, same. I was always more like, I don't know, I love drinking teas. I was always more the holistic route. I hated taking medications. I didn't even care to go to the doctor. I'm like, unless I really need to go, I'm not going. Um, and then obviously like my whole shift happened after pregnancy. Well, during and after, but there wasn't much that I felt confident to do while pregnant. So I really waited until after. And now I'm like, okay, time to root cause, figure out what's going on, heal my body before I try to, go at it again. Um, no, I didn't even know about the birth control and how you don't ovulate. I mean, maybe that's just like negligence on my end, but never knew that. I don't know how
Oh
many
no,
people
they
do know
don't tell
that.
you that. They
No.
don't tell you that. Why would you know that?
And it's like, that's so, to me, I'm like, okay, I would never want my daughter on that because then she might have issues later on. If you're stopping your body from ovulating for how many months or years that you're on this, what can that do to you in the future?
Yeah.
Um,
But that's why I like the Mirena, right? Because I was saying like the
yeah,
Mirena, like a lot of people do still ovulate because it is a local
yeah,
hormonal thing. But again, that then it comes with its own issues, right? Because there's also like this foreign object inserted into your body, which not as damaging as maybe the copper, but like, there's lots of conversations to be had about birth control by itself.
yeah, no, definitely. Um, well, I guess for like, I wanted to ask what your advice would be to somebody that is struggling with fertility. Like what advice being in the role that you're in, talking to the many patients that you have, like what's some advice that you can give, those women who might be listen to this episode or even moms that might have one but now are struggling to get pregnant with another.
Yeah. It's actually kind of a loaded question because I feel like there's different things that I'd want to say to everyone. But ultimately, I always like to say, like, remember that you're doing the best you can. I feel like fertility is a really hard and isolating journey. And just know that, like, in this moment, you're doing everything that you can, right? Like, you're doing the best you can. And I think some people hold a lot of blame in their heart. And I think it's really important to recognize that you are only one individual. You have not been educated the same way as other people have, right? And that's not your fault. That's not your fault. Now you're having
Mm-hmm.
to do stuff on your own. But then I would also say, like, find an advocate that you do feel like is actually educating you, that actually hears you, that's actually listening to you. And it doesn't have to be me. Like, it can be it can still be like an OBGYN or like your old midwife if you're going through secondary infertility. It can be a health coach. It can be a fertility coach. There's so many different people out there that are willing to like hear you and listen to you and like give advice. Obviously, you want to make sure it's safe advice for what
Mm-hmm.
they can give to you, but ultimately, um, yeah, know you're doing the best you can. Find an ally, someone that, like I said, you feel like you feel listens to you. But then also definitely try to find like that root cause, and don't try it by yourself. Try to really have someone that can help you, because I will say majority of my patients have actually been diagnosed with unexplained infertility. And there's usually multiple reasons of what's going on. And it's not one big thing, but it doesn't have to be one big thing. A lot of little things can add up to the big thing. And so, don't have people overlook, normal versus optimal values. And then definitely don't overlook your gut health.
Mm-hmm. Um, and as far as people who live in Arizona or Washington, where can they go to get a hold of you or to figure out, how they can get like a consult with you and learn more?
Yeah. So, well, first off, for anybody, my Instagram, my YouTube, have a ton of information on it, like a lot. I talk about gut health. I talk about optimal values. I even have a bunch of freebies on how to track your ovulation for optimal semen analysis values, like all free stuff. So check out that. Everything for me is just walk the natural path everywhere. Instagram and I was going to say Facebook. I barely use Facebook, but Instagram, TikTok, YouTube, all of that. I do have a website. it's walkthenaturopath.com, but you can also get through there via Instagram. I think Instagram is a really good hub for me. I have my link in bio that has all my freebies on it, as well as my link to my YouTube. I also have courses that you can purchase. So a lot on there. And then I do require a consultation before we chat. I do think it's important to make sure we fit, right? I want you to make sure you feel like you can open up and tell me everything. And I want to make sure that I'm a good fit for you. So getting that consultation is important. I do have free consultations as well as paid consultations that are a little bit longer. So you're welcome to check those out. And again, those are available on my website at walkthenaturopath.com.
Okay. And I'll make sure to link that. Like I said, I know I'll be tagging your Instagram as well. And I know that everyone can go there, but we'll go ahead and tag that and insert that in so people can go ahead and check it out. Um, well, I just want to thank you so much for your time. Thank you for all this information that you shared. I've learned, I'm sure whoever listens will learn multiple things. And I just so appreciate just your knowledge, your, dedication to helping many women and couples obviously achieve, bringing life into the world. It's beautiful.
Thank you so much for having me.
Yeah, of course. It was so nice meeting you.